Welcome to the second video by Supporting Child Caregivers. I'm Alexandra Harrison, and today I would like to talk about breastfeeding in the time of COVID-19. According to the latest information, the World Health Organization, the U.S. Center for Disease Control, and the American College of Obstetrics and Gynecology all recommend continuing breastfeeding during the pandemic. They recommend that you give your baby your milk, even if you think you might be infected, or even if you are infected with the virus, because your milk is the best protection your baby can have. Here are some of the common questions that mothers ask about breastfeeding during this time. The first is, can I breastfeed my baby during the pandemic? And the answer is yes. But the World Health Organization recommends following certain rules of hygiene in order to protect your baby. They recommend wearing a face mask, washing your hands before and after you breastfeed your baby, and cleaning and disinfecting surfaces that you might touch. The second question is it safe for a mother to breastfeed her baby if she's infected with the virus? And the answer to that is yes also. First, it's important for the mother to contact her own doctor, her own healthcare provider, if she has respiratory symptoms such as coughing and if she has a fever, and to follow her provider's instructions. But after that, if she follows these respiratory infection prevention procedures, such as face mask, hand washing, and disinfecting surfaces, then she can breastfeed her baby. The third question is whether COVID-19 virus is transmitted in breast milk. And that's a more difficult question because we really don't know enough about how the virus is spread. We do know that the virus is spread in droplets from coughing or sneezing or even talking. But there have been relatively few studies about breast milk. Those few studies have not found the virus in breast milk, but we still don't know for sure that it isn't transmitted in the breast milk. The third question is, what are the best recommendations for mothers who want to breastfeed their baby during the pandemic? And the general consensus is that breast milk is the best nutrition for your baby. Infants are born with a preference for the smell of their own mother's milk compared to any other milk. And of course, breast milk is less expensive than formula. Another important benefit of breastfeeding is that breast milk protects babies against illness through the direct transmission of the maternal antibodies, of the mother's antibodies to the baby. It's important to know that UNICEF recommends breastfeeding mothers not be separated from their babies at birth, even if they are infected. Instead, mothers should follow the respiratory hygiene rules that we have been discussing: mask, hand washing, disinfecting surfaces. But why is it so important that mothers not be separated from their babies at birth, even if they're infected with the virus? And the answer is that this separation can interfere with establishing breastfeeding. If you wait even 7 to 10 days after birth, it may be very difficult or even impossible to breastfeed your baby. In fact, the ideal time to introduce breastfeeding is within the first hour after birth, because then newborns tend to be awake and alert, and after that, they often fall asleep. In addition to all these benefits that I've mentioned about breastfeeding, breastfeeding supports mother-infant bonding in a number of different ways. One of them is that oxytocin, which is a hormone that is released during childbirth and breastfeeding and during skin-to-skin contact, can be very helpful in mother-infant bonding. Sometimes we refer to oxytocin as the love hormone because if it is squirted into the nostrils of a fighting couple, they tend to resolve their conflicts more easily because oxytocin has the effect of decreasing fear and increasing trust between two people. Several studies have shown that oxytocin release is related to higher maternal responsiveness to her baby, lower maternal stress, and better infant-mother bonding. And also, the baby's visual acuity, the distance in which the baby can see most clearly, is the same distance as between the mother's face and the breast. So some of the best times for the baby to take in social information is during feeding. But in spite of all the benefits of breastfeeding, bottle feeding is a perfectly acceptable way to nourish your baby. What really matters is what works best for the mother and her baby. And if a mother chooses not to breastfeed, or if it's too difficult for some reason for the mother or for the baby, then their mutual love and bonding and the baby's healthy development is not going to be at risk. Although early studies emphasized an association between breastfeeding and maternal-infant bonding, more recent studies, for example, one study from 2019, concluded that mother-infant bonding is not associated with feeding type. It's vitally important to remember that taking good care of your baby means taking good care of yourself. And that means avoiding holding yourself to unrealistic or culturally preferred standards instead of doing what works best for you and your baby. The famous pediatrician and psychoanalyst Donald Winnicott referred to the good enough mother. And by that, Winnicott was reminding us that mothers must not expect themselves to be super mothers, to be perfect. Instead, it's good to expect yourself to be good enough. Just good enough. Good enough to love your baby and good enough to help your baby grow.